Hey, welcome in. We have a very special guest, Dr. Adam Annaccone from the UT Arlington Athletic Program. He is an assistant clinical professor and has in-depth knowledge on the spine. Obviously, Bradley Beal, the report yesterday from Sham Sharani of The Athletic is that he's dealing with a disc issue in his back. They said it wasn't structural. But Adam, first off, thanks for joining us. And I want to start here. How can somebody have an issue with a disc in their back, but it not be structural? This has been a question that's come up a lot over the last day.
Yeah, so the spine itself is relatively unstable. You have vertebrae that are stacked on top of each other, right? And then you have ligaments and musculoskeletal and other soft tissue support to try to provide that support there. And then contained within each of the discs is almost like a little marshmallow here, right? And this is considered the disc. And the disc takes a lot of the load of the entire body weight. And when we talk about transferring load from the lower extremity to the upper extremity, when we talk about daily movements, those discs withstand a whole lot of force. And so certain movements can irritate the disc, just like you can irritate a muscle, you can irritate a ligament, you can pull those, you can actually irritate this disc or this little marshmallow. And what happens when you irritate that, depending on the severity, on the posterior aspect or the back part of this disc right here is your spinal column and your spine and your spinal cord. And so what can happen is if that disc protrudes out far enough, it can actually impinge upon that spinal column. So when they talk about it being structural and there's no damage to the structures, what they're talking about is the ligaments, the musculoskeletal components around it. The entire injury is to the disc itself. So that's a really good sign because the disc can heal over time. And the biggest thing that we want to do is decrease that irritation to that disc. And hopefully that will then protrude back or go back to its normal shape. This way it's not impinging upon that spinal column or that spinal cord, creating that sensation of pain going down to the lower extremity.
So are they essentially a shock absorber, and is it like a marshmallow where it will regain its shape?
Yep, exactly. It will regain its shape. Now, what we know over time is as we age, we tend to lose the amount of water that we have within our body, and things start to break down over time. So that marshmallow, for someone who is young, 19-year-old just starting in the league is probably relatively in good shape. An individual, a vet in the league, will probably have a little bit more deterioration to that disc. But overall, the discs are pretty resilient and they bounce back pretty quickly, no pun intended, to any type of injury. So much like a marshmallow.
So what kind of therapy are we looking at? Is it just rest? Is it rest plus like muscle stimulation or anything like that? Like what kind of process could this be?
Yeah. So low back pain is very common. I think we hear it all the time. And I think one of the things that tends to happen too much is too much rest. So the spine does require some mobility. So you want a little bit of rest, a couple days of rest, but then it is really getting back into regaining range of motion and staying as active as possible. And then also working on core strength. And so when people think of the core, they think of just abs and six packs. It goes well beyond that. You have both global and local muscles within the abdomen, but we're also talking about the glute. We're talking about the diaphragm, everything pretty much from right below the nipple line down to right below your gluteal fold or your gluteus maximus. That's all called the lumbopelvic hip complex. And we need all of the muscles within that area to work properly to help stabilize the spine. And so it's really a complex system. But in order for us to get back on the right track, we need to mitigate the amount that we're sitting around and resting, because if you're resting, things start to stiffen up. We need to increase our mobility and we need to increase our strength and stability in that area.
Obviously, we don't know specifics when it comes to Bradley Beal, but in general terms, when there is a disc injury to a high performance athlete, How long is a recovery typically in that case? I know it can vary some, but in general, what's that look like?
Yeah, I'm not sure the latest timelines that maybe they put out there in that specific case, but a general guideline can be anywhere from 2 weeks to 8 weeks. First and foremost, you want to make sure that that disc has relative time to heal up, but that doesn't mean you're sitting around not doing anything. You probably want to avoid motions that are going to increase that pain. So you're going to give the disc some time to heal. And then after that point, it's really making sure that you have the mobility and the stability and strength to be able to withstand the demands of playing basketball and competing at a high level. That's why there's that big time frame from 2 weeks to 8 weeks, because it just really depends on the severity of the injury to the disc, how long that is going to take to heal up, and then the programming that you have to go through to ensure that you're able to withstand the demands of the sport.
Is the disc, is it typically only irritated because of the amount of physical activity that Bradley Beal might have incurred this injury, or at least disturbed it, or is this something where, like, even just like normal everyday activities like we all do, it would also irritate in that kind of factor?
So the answer is yes to both of those. It can be irritated by any type of specific movements. Typically, the disc is irritated by improper lifting techniques, right? So we're always taught, especially from a young age, with lift with your legs, not with your back, because what we see a lot of times is you bend over, say, pick up a carton of books or something like that. You bend over right at the back, you go to extend, and then you rotate to place that either into the trunk of your car or into something like that. That type of movement, the extension with the rotation, is the mechanism of injury for the disc. So it could be everyday tasks of what we're doing around the house, or it could be some type of explosive movement that could also irritate that disc. So yes to both of those.
And I'm assuming that because you said about 2 to 8 weeks, there's a high likelihood, a high rate of recovery in this instance.
Yep, absolutely. And especially when we're dealing with nerve irritation. So as I said, that disc can protrude on that spinal column, on the spinal cord, and on the nerves that are coming out from either side. And I won't get too anatomically in depth with that. But it's really about relieving that pressure, allowing that disc to heal up. And then with that, that sensation will go away, that pain will go away, irritating those nerves. And then it's just, as I said, preparing for the demands of the sport.
Is this something that once it happens, there's a more likelihood that it happens again, or is this rest and the work that you said on the core and other aspects can basically mitigate it, and it's not something you worry about again unless you do something?
Yeah, so that really depends on the individual. If we are dealing with something where, as I talked about before, our age can factor into this. So our bones start to deteriorate. The spacing between our vertebrae tend to decrease over time, and so that marshmallow will squish down a little bit more as we get older. Those individuals are probably at a higher likelihood of having some sort of disc injury reoccur again, just because of the breakdown in the structure itself. Individuals where this is a one and done type of movement, you had talked about activities of daily living, going about doing some gardening or something like that, and you irritate the disc, then the chances of that reoccurring again are relatively small, because the disc is going to heal itself and go back to a normal function. So individuals who are younger, certainly we don't see a whole lot of reoccurrence of this. If we're just talking about the disc, individuals who are older, who have some other things that may be contributing to this, then yeah, they're probably more at a high likelihood of having this irritation happen again.
All right, Adam, one last question for you. Are you going to eat those marshmallows, or can you send them my way? I see how it is. Thank you so
There you
much,
go.
Adam.
Yep.
We really appreciate your time. As always, one of these times we're going to have you on when there isn't some kind of major injury and we can just talk about performance training and everything. But we appreciate your time, as always, my friend.
As always, it's great to talk to you guys. Thanks for having me back.